So much.
That's
Rahul, I'm going to introduce Rahul BHOLA next for the sake of time. Rahul is Chief of Pediatric Ophthalmology at Children's Hospital of Orange County, LA, but he's a proper desi.
No, it's such a pleasure to be back in Delhi. I've spent half of my life in Delhi and half of my life in the US now. So, thank you. Well, first, is it working? Yeah. No. Let me. So, first of all, it's such a pleasure to represent WISPOS, which is the world's largest pediatric ophthalmology society. So, thank you so much, Ken, for inviting me. And I'll be switching gears a little bit. I'll be presenting on the illuminated microcatheter facilitated trabeculotomy for childhood glaucoma. And so this video is a kid who had juvenile glaucoma, and we did the eye-track catheter trabeculotomy. So let me start the video here. Is it playing?
I think so. Yeah, play it now. Yeah, there you go.
Playing? No?
AV, can we play the video, please?
Nope.
What do you want to do? Just
I'm just doing that, but it's
try,
not.
try that.
It just stops in between, so I don't know. It's just a little sketchy.
Yeah, I think, unfortunately.
That's the next one.
Okay, go back then. Let's go back. That's the one. Here we are. We got the AV guys here. Hopefully they'll be able to fix it. Okay, it's a bit sketchy, but
okay,
it's working.
I'll just, so, after placing the traction sutures, basically we move the eye inferiorly, and then I'm doing a superior phonic space conjunctival peritomy with cauterization. Then we make a superficial scleral 4x4 millimeter flap, and then we try to dissect very meticulously all the way anteriorly into the clear cornea. And then we use a, is it playing? It's kind of, okay.
Slow.
So then a deeper scleral flap is made. First we are doing the, now the deeper scleral flap is made, and now we put the microcatheter in the Schlemm's canal and advance it very carefully with smooth, even forces. Wow.
We've done pretty well to get to this far. Can you help us? What's happening?
Do you want the? I have it on my pen drive as well.
Present that.
AV, either आना वो computer is shut down.
Yeah, I'll get it.
Can we play on the other one?
Already submitted. You can play that. We'll stop again.
इसका क्या हो? Can we use the other one? मैं अपना निकालूं?
I'll just play it on my computer.
Yeah.
Okay.
Probably from there. Go there.
So let me just ask some questions while we're waiting. So what Dr. BHOLA is showing is that kind of 360 trabeculotomy ab interno. How many people do glaucoma surgery for children? And how many people use a microcatheter or the GAT instrument with the suture? Yep. How many people do a trabeculotomy from outside, the traditional trabeculotomy? And how many people do a combined trabeculotomy? Okay, so everybody does everything. Good. All right. So let's go back, and while we're waiting for Rahul's video, anybody got any questions for any of the other videos? Well, or this video is all this non-video.
So, Dr. BHOLA, I was just wondering, why would you not do it ab interno in a cornea like this? I'm Sushmita from Chandigarh, India.
Oh, hi, Sushmita. Hi, how are you? Yeah, it's just the procedure I've been very comfortable with, and it was a very steep learning curve, actually. Initially, I could only do it maybe in the 60% of the patient, but now I'm very comfortably able to do it in 80 to 85% of the patients with excellent results. So
This
I've been, yeah.
Okay, but
So-
now would you consider?
Yeah, actually we can, let me see if it's playing, yeah.
Thank you.
Thank you. Okay, that's much better. So we place the traction sutures, move the eye inferiorly, do a superior phonic space conjunctival peritomy, and do cauterization of the vessels, and then we do a 4x4 millimeter superficial triangular scleral flap with a 15-degree super sharp blade. We dissect that, kind of move it interior in the clear cornea. Then a deeper scleral flap is formed with the same blade, and the Schlemm's canal is unroofed on the sides. By just lifting it laterally, you'll see it right here. I'm unroofing the Schlemm's canal. You see a little bit of aqueous ooze out, and that tells you that you're in the Schlemm's canal. Then you put the micro catheter, advance it very carefully, slowly with even forces. Just move it, observe the tip, which is illuminating. Then it comes out of the distal ostium. And then you just pull both the ends of the catheters, which you'll see in a second. It comes out, you pull both the ends and just kind of zip it out. And then you'll see hyphema at this point, which is actually a good thing, which tells us that you've kind of unroofed the trabecular meshwork. And then you close the, you take out the deeper flap and you close the superficial flap with the tenor nylon. You wash it out and you close the conjunctiva with atovical suture. And then let's see, I have another slide. So this shows actually a more deeper superficial, that's how I make the superficial scleral tunnel, which is very kind of, it's a very critical step, so you have to be very gentle, you have to use gradual, purposeful movements. I use a grease harbor blade, but you can actually use a crescent blade if you want. And you got to maintain the depth, that's the most important thing. You got to maintain the consistency of the depth. And then you go to the deep tunnel. This is the deep. Oh, there we go. So the main thing with the deep tunnel is that it has to be done at the junction of the gray, where the grayish blue joins the white sclera. So that's where the scleral spur is, which is right above the Schlemm's canal. So you got to very carefully dissect that. And then you can enter the Schlemm's canal either by unroofing it on the lateral edges, or you can make a small radial incision in the center, and then you see the aqueous ooze out, and you can put the microcatheter. So in my hands, it's a very safe and effective procedure for childhood glaucoma. It has definitely a steep learning curve. I've been doing it for almost 15 years now. You just got to go slow, have a good magnification, perform meticulous dissection. I think further technological advancements may enable endoscopic visualization of the Schlemm's canal and provide better understanding of the disease process. Thank you.
Very much.